New videos every day.
This is Athena Jezik, and this is a demonstration on low back work. I'm getting some lotion on my fingers and my hands to put on her back. Where a lot of people have pain and discomfort in the low back is in the SI area, the SI joint, which is the joint that comes between the hip, ilium, and the sacrum, which is right in this area here. There's a lot of muscles that attach into this area, big leg muscles. There's also back muscles. It's quite an active area. It's the stability point in our body. And a lot of us have low back pain because of the way we sit, either at our computers or in our cars. And we have low tone in our abdomen, so we're not able to support the back the way it needs to be supported. So here I'm just assessing the muscles a little bit, and then I'll show you the techniques that I use. There's a lot of roughness going on down here. So to take my thumb along here, and I'll take my finger so you can see it better, and just assess going along the muscle. And this is not with a lot of pressure. This is just feeling the more superficial muscles, picking up whatever you're feeling, letting the hands communicate with the body. And the same thing over here. There's a bit of roughness, or sometimes you feel little micro tears. It feels like little bubbles, little packing bubbles in there. Oftentimes what that is little tears in the sheath that goes around the muscle, or it can be a little bit of lactic acid buildup. You can usually tell when it's a tear. They're pretty obvious. They're pretty big. I don't feel any in her. Now here's the sacrum. This is an important joint to stay mobile. The sacrum needs to be mobile from the hips. It's real important. What happens as we sit and we compress this area, which makes it pretty immobile. And when it's immobile like that, then we begin to feel a little bit more back pain because we're stiffer. So here I just have my fingers on the edge of the sacrum, and I'm again allowing the sacrum to do what it needs to do. It'll begin to move itself around to try to find a new position, or to just loosen itself from the hip bone, or the hip bone from the sacrum. But we're not feeling the movement of the hip, but that is also taking a little bit of movement. And when the sacrum rocks back and forth like this, it's like a teeter-totter going up and down. That's usually a sign that the sacrum is trying to break away from something, to break loose, because the normal position, the normal rhythm of the sacrum should be a forward and backward kind of a rocking position. So when it's going back and forth, it's definitely out of what it should be. But it does that and gets itself loose, and then we're doing the similar technique that we have done earlier. We demonstrated earlier, getting knots out, going deeper and deeper in as the body pulls in. Use that same technique down here, even though there's not a knot per se that we're on. We're dealing with trying to get muscles to move, bones to move, reposition themselves. So to go slowly and be invited in is always going to give you a lot better result, because the body is allowing it, it's ready for it, and it's asking for help. One thing about the more subtle work is total yielding to what the body wants has to be the therapist's main objective. It's not a therapy of deciding what to do and then trying to force the body into something. It's really allowing the body to do what it needs to do, and just following that anatomy so that it's able to find its way to a new position. It's not what we're used to. We're used to being in control, and we're used to being a little more brutal on the body. That's what we're programmed into. So there's a lot of people that have a little bit of issue about not being able to feel things into a pain scenario. It doesn't have to be painful to get results. Anybody that's had craniosacral work will know you barely feel anything and the results are phenomenal. Now my right hand is stabilizing the sacrum. Okay, and now there's a lot of looseness there. The muscles are much looser all along here. Now finding that L5, S1, and I place my fingers on either side of the spine there, right at L5, S1, coming right in there. Then I place the rest of my hand on the sacrum. I'm going to get ready to do a traction. I take this hand up to the base of the skull and get it between the occiput and the atlas. Then I allow my fingers to be invited in to where I can get between the vertebrae and all the way down to where I'm feeling the dural tube. The dural tube is that membrane that goes around the spinal column. Whether I'm actually on it or not, or feeling it energetically, it doesn't matter because there's a lot of activity right now going on. And once I'm there, I just push a little traction, pushing a little bit upward into the head and giving a drag downward and giving a stretch to the entire spine. This also allows the sacrum to be able to open up and to find its place. Okay. And to see the position of the sacrum, I'm going to just rest my hand there. And it is moving in a forward-backward rhythm. There's no more wagging. And the muscles here have a lot more smoothness to it. If she was a client of mine and I was working her for an hour, I may take a cup along here. But if I don't take a cup along here, it's changed enough that I would be happy with the results of what it's changed to. And there is a little low back release.
If you liked this video, we have hundreds of more alternative videos ranging from sexual health to psychology to mind control. So if you liked it, go ahead and click on me to enter the Psyche Truth channel.